Ms. Wallace!
Dr. Culver, what are you doing here?
This is a hospital, Beth. This is where I work when I'm not in my office.
Oh, of course. Well, listen, have a good evening, okay?
Not so fast, Beth. I've got a few questions that have never been answered to my satisfaction.
Oh, really?
Really? About your so-called pregnancy? What's going on with you, Beth?
Really, Dr. Culver, I don't know what you're talking about.
You know damn well what I'm talking about. We discussed this before. You showed up in my waiting room one day looking quite pregnant when only a few months earlier at your annual exam you most certainly were not with child.
Well, there's plenty of women that get huge long before they're going to deliver their babies.
Baby,
you know?
Miss Wallace, or the sack of sugar you were wearing around your waist to make you look pregnant? What kind of twisted stunt are you trying to pull off?
Well, your nurse must have me confused with one of your other patients.
Not a chance. She's quite certain it was you who walked into my waiting room wearing pounds of sugar around your middle. What on earth were you thinking?
You know what? I gotta get going, Dr. Culver.
Dr. Calder. Ethan Winthrop.
Oh, yes, of course.
My wife has an appointment with you tomorrow.
Well, I look forward to speaking with her.
As a matter of fact, she's about to be discharged. If you have a minute, she would love to have a word with you.
Fine. I'll be right here.
Great. Thank you.
Sure. Oh, Miss Wallace!
I really have to run, Doctor.
No, what a shame. I'm about to speak to a friend of yours, Gwen Winthrop. I wouldn't be at all surprised if your name came up. Can't stick around. I gather Gwen Winthrop has some questions about you.
Well, I don't know about what, but I can't stay, okay? I gotta run, Doctor.
Well, then I'll just do my best to tell the woman whatever she wants to know on my own. Well, it's an emergency.
Huh. What do you know? I was just going to ask Dr. Culver some questions about you, Beth.
Well, I'm afraid they're going to have to wait, Mrs. Winthrop. I have a patient down the hall in distress. If you'll excuse me.
Yeah, and I was just gonna go.
Yeah, why am I not surprised?
Really, Gwen, it seems like you'd have much more on your mind than giving me a hard time.
Yeah, you're right, Beth. You know, at the top of my list is getting my best friend released from the psych ward as soon as possible.
Yeah, I don't think they're gonna discharge Sheridan. She's obviously got a very loose grasp on reality, so...
Why, because she keeps insisting that your baby's hers? Well, we'll just see who has a loose grip when I'm finished with you, won't we, Beth? Let's go.
What am I gonna do? Try to kill Gwen again? She's like a cat with 9 lives. How am I supposed to make sure that she dies next time? Maybe I don't have to kill her. My Dr. Culver never saw me with that bag of sugar. He just heard about it through that busybody nurse of his. So he doesn't even know whether or not I had a baby. I don't even know why I'm so worried. There's nothing that he can tell Gwen about me that's gonna get me in trouble. Okay. Uh-huh. Okay, well, you can stop gloating, Mother, because I don't care if Gwen goes to her appointment with Dr. Culver tomorrow, okay? Because he does not have fact one about me and my pregnancy, or little Martin for that matter.